Hello everyone, this is Dr. Vivek Goel, your nephrology faculty at DocTutorials, and it gives me immense pleasure to introduce to you Dr. Tamilselvan P, who has scored a prestigious rank of 4 in the AIMS merit list and a rank of 8 in the common merit list in the recently conducted INI Super Speciality April 2024 exam. So a big congratulations to you, Dr. Tamil.
Thank you, sir. Thank you very much, sir.
So, first things first, Dr. Tamil, first
Yes,
tell
sir.
me how did you exactly feel when you saw the result and you saw this rank against your name?
I was happy, sir. I wanted nephrology, so I was very happy that I got the branch, the subject which I liked. So I was very happy, sir. Uh,
What
I
was the
wanted
reaction of your
nephrology.
parents, your
They
spouse?
were
What
also
was the
happy, sir.
reaction?
They were also very happy, sir. Because
Great.
from my medicine days, even when I started medicine, I was very clear in my branch that I wanted nephrology. So
Why?
nephrology
What
was my
attracts you to
destination.
nephrology? What attracts you to nephrology?
Basically, the cases which I saw, sir, I had more interested towards AKI, and my thesis was acute interstitial nephritis. So, nephro was my destination, sir. So, I was very happy when I saw the rank.
Great. So, Dr. Tamil, can you give us a brief introduction about yourself? Where are you from? Where have you done your UG, PG, and other
Yes.
training from?
So I'm from Namakkal, Tamil Nadu state, sir, from district of Namakkal. I did my undergraduation from Madras Medical College, Chennai, and I did my post graduation from Jipmer, Pondicherry.
That's great. When did
Yes,
you
sir.
complete your MD?
In December 2023, sir.
So this was your first attempt at the INI.
Yes, sir. This was my first attempt at INA.
That's great. So in his very first attempt, Dr. Tamil has not only cracked the exam but also topped the exam. That is a superb feat. So, Dr. Tamil, what I want to ask you is for any
Yes, sir.
student who is currently pursuing his MD medicine or DNB medicine or pediatrics, who is
Yes,
looking
sir.
at you,
Yes, sir.
who wants to draw inspiration from you, who wants to
Yes, sir.
know what path did you choose? How did you crack this exam? Can you please break down the strategy for them?
Yes, sir. I actually wanted nephrology. I was very clear in my branch, and I to start preparation. I actually asked my seniors who are already doing nephrology in AIMS and JIPMER, my institute, and actually they recommended to go with DocTutorials videos. It was very good. Actually, they only recommended. Till then, I was not aware of DocTutorials. I have to study in DocTutorials, but they only recommended me to go with among all the so many things are available in online. But for nephrology, DocTutorials will be very good. My seniors only suggested, so I went with DocTutorials. I subscribed to 3 month.
How did
Uh,
Doc Tutorials help you? How did Doc Tutorials help you?
uh, like uh, nephrology videos, initially there was no notes available, so we only have to write our notes. Or initially, first some videos I found it very difficult, but with seeing more and more videos, I started liking the subject even more with your lectures, sir. Actually, the way you took those lessons was I was very happy to learn, sir. And it was not, it was like completely your videos were of like Figali only, sir. If we see your videos, we don't, there's no need to read Figali actually. And if we read Figali, if we are thorough with Figali, we can crack the exam, because more the core nephrology questions comes from Figali only. So it is like seeing your videos is equal to reading Figali. So for me your videos is was only enough, sir. So
Okay.
I was happy.
That's great. That's great. Thank you so much for
Yes,
the good feedback, Tamil. Acha, for any
yes.
student who wants to pursue the exam, can you explain the exam in a bit more details? How many stages there are in the exam? What are the number of MCQs? What are the marking scheme?
Yes, sir. Actually, in the stage one exam, it was MCQ exam. 80 questions were there. This time around, around 60 questions were like from nephrology. Some only I felt like only some 20 questions were from medicine part. And most of the questions like core medicine, core nephrology questions were from Figali only, sir. I felt it was from Figali only. And out of those 60 questions, some 40 were very easy type of questions, and 10 to 15 were medium, and some 10 were somewhat tough questions. And the Harrison, 20 questions were from medicine. Those 20 questions were from Harrison based questions only, sir. They that directly they took it from Harrison. Actually, they are thorough with Harrison. They could have answered those 20 questions. And if they are thorough with Figali, or if you have seen your videos, then those nephrology questions would be very easy. This time the exam pattern was like that only, sir. Then in
What
stage two,
are the topics? What are
yes,
the topics in medicine that you would, suggest focusing on more for the future aspirants?
medicine topics, I'll suggest to focus more on neurology, sir. Neurology. This time, most of the questions were from neurology and neurology, critical care, and infectious disease, sir. Infectious disease. So there were some 3 to 4 questions from tuberculosis. So neuro, infectious disease, and critical care, I will tell to focus on more, and some miscellaneous topics, like high altitude, some miscellaneous delirium, some miscellaneous topics also they were focusing on. Paraquat poisoning, some questions.
Good,
So
very
most
good. And in nephrology?
in nephrology, actually, glomerular disease will form the course. Uh, they were more focused on glomerular disease. Usually, there will be more questions from AKI and CKD, but this time I felt it was less. And this time there were somewhat more questions from dialysis, and from transplant they asked very basic questions only, sir. From
Basic
transplant,
question.
but this time there were more questions from dialysis. Like I have seen your previous year questions videos also, sir. But comparing with that, this time there were more questions from dialysis topics. And transplant, it was only basic, and
True.
the glomerular disease, literally from every topic they asked on questions.
Yeah.
And yes, sir.
So glomerular disease is always a very, very important topic.
Yes,
As I always, I very much tell the students that please stress on this topic. This is very important. Read Fihali, go through my videos, go because the latest KDIGO guidelines are very important for the management, which I
yes,
have
sir.
discussed in my videos, which are very, very important.
Yes, sir.
So that's that. And did you appear for the tests at DocTutorials, the GTs, the
Yes, sir.
subject-wise
There
test
were
series? Did
three.
those tests help?
Yes, sir. 3 grand tests were there scheduled in the month of April, sir. I attended all 3 tests, sir. Uh, like I scored in one test 10th rank, and one test second rank, 10 and 2, sir. Actually, it was
So
like final. It was more similar to DocTutorials rank only, sir. Final rank list was also.
So this is what I was talking about. At DocTutorials, we try to simulate the exact exam. We
Yes, sir.
try that the toughness level is almost at par or is at a bit at a higher level, so that once
Yes,
you
sir.
appear for these tests, the final exam will appear a bit easy to you.
Yes, sir.
So taking these tests, solving these questions, reading, going through the videos, this is very, very important. Very, very
Yes, sir.
important.
Yes, sir.
And
Yes, sir.
those students who are there with me in my WhatsApp group, that I was posting a
Yes.
lot of, in the last 2 days, a lot of one-liners, a lot of important notes, voice notes,
Yes, sir.
and
That
more than 10
one session.
questions came from
Yes, sir. You conducted a
they
session the
came from
previous
those
day.
topics only.
It was also very useful, sir. Many questions were from that. Some 4 to 5 questions were I wrote because of that previous days, because I attended that session. I felt
Exactly.
actually very thankful to you that day, sir. When if would I not attended, I would have made mistake in those questions.
And what about the stage two of the exam, Tamil? How did you prepare for that,
Uh,
and what was that like?
Stage 2 preparation was also what my seniors actually told us. Vivek sir will conduct a mock interview session. You should not miss that. If you attend that, he will cover all questions, all possible questions. That was only my senior. It was told by my seniors, sir. Then I actually watched the videos which you conducted for the previous sessions. It was available in YouTube. So Based on that, I got orientation what will be asked in the what they will ask in the interview. So actually that helped me, sir. And like that previous 2 days you conducted till 1:30, you conducted those mock interview. Actually, that only helped us.
So, did that help, or that was a
Yes.
burden that you had to be awake at till 1:30 a.m. in the night?
No, sir. Even if you conducted for 1 more hour, we could have attended. That was actually very helpful, sir. That actually built the confidence to talk in an interview, sir. Actually,
Exactly. Though this year's interview was not that structured, you didn't get image-based questions. It was more of a
yes,
random
sir.
Viva-based thing, but still
Yes, sir.
you got oriented and you got confident about the interview.
Yes, sir. Because that mock interview, almost you covered everything, sir. From image-based questions, images, ECGs, ABGs, electrolytes, everything you covered, sir. So they know whatever they ask, they will answer. That confidence was there, sir. Because we attend, it was like a mock interview session only, sir. You made us answer those questions. So that confidence was there. So whatever they will ask, they can answer. That confidence was there.
Superb, Tamil. Superb. Thank you so much for the feedback. And now the million-dollar question: which college are you
Yes.
going to choose? What is your college
I
of choice?
I have not yet decided finally. Like I'm still in oscillation. Like I have to decide, sir. We'll go with either PJMR or
What are
AIMS
the
ID.
Absolutely, absolutely.
Yes, sir.
Superb, Tamil. It was great
Yes, sir.
chatting with you. Keep the
Thank
flag
you,
of
sir.
nephrology high and convey my regards and my affection to your family. You have done a
Thank you,
wonderful
sir.
job. It's time for you to enjoy. And I
Yes,
hope we will keep meeting in nephrology conferences in the future and we will
yes,
keep in
sir.
touch.
Yes, sir. Thank you, sir.
Thank you so much, Tamil.
Thank you, sir. Thank you, sir.